So you just multiply the 1,000 times 50, and you have 50,000 people in America. So this is growing. It is growing at a massive rate. You're going to hear from Governor Hassan about New Hampshire. She is doing a fantastic job up there, but this is something that we're going to have to deal with on a national basis. During the first half of this year, the number of opioid-related overdoses was more than 4.5 times the number of motor vehicle fatalities in Massachusetts. 4.5 times. No longer 1-to-1. No longer 2-to-1. 4.5 to 1 in terms of fatalities. Who is the typical victim of an opioid overdose? Who is the typical substance abuser? The answer is, today, there is none. This epidemic does not discriminate on the basis of age or gender or race or ethnicity or economic status. In fact, between 2002 and 2013, heroin use doubled amongst women and more than doubled amongst non-Hispanic whites. It increased dramatically among people with incomes above $50,000 and with private health insurance. Opioid addiction doesn't care if you live in a city or you live in the suburbs. It doesn't care if you have a white-collar or a blue-collar job. The 50-year-old white male attorney from Winchester is just as likely to become addicted to prescription drugs or heroin as the 22-year-old Latina waitress from Worcester. Opiate addiction is an equal opportunity destroyer of lives. Those addicted to opiates are too often stealing from their friends, from their families, from their neighbors, or complete strangers to fuel their addiction. Cars are broken into and valuable stereo systems are left intact while a few dollars in change is stolen. Homes are broken into and flat-screen television sets remain untouched while children's piggy banks go missing just to get enough money for the next hit. The prescription drugs are taken from the home, money is taken from the home, but electronic equipment is left there. That's how desperate these people are for the immediate hit which they're trying to get before the end of that night. That is the crime wave that is hitting Massachusetts. That is the crime wave that is hitting our country. That is why people break into people's homes in 2015. If we want to deal with the crime wave, we have to deal with that. The impacts of addiction are also causing immeasurable harm on the families of those in the unbreakable grip of opioids. Too often, I hear the stories of parents who have drained their entire life savings to provide the treatment and recovery programs necessary to beat this addiction. Many times, it results in bankruptcy filings that were unimaginable only a few short years ago. This crisis is robbing people of their friends, of their family. It is robbing them of their livelihoods. It is robbing them of their freedom as they look out from behind prison bars. And much too often, it is robbing them of their lives. If we don't act now, we could lose an entire generation of people. Now, I'm hearing enormous frustration from people who don't feel the resources are being brought to bear to tackle this enormous crisis. Let's compare what we did as a nation when confronted with another deadly epidemic, Ebola. In less than a year, the United States spent upwards of nearly $2 billion, dispatched the medical community and public health experts, and built entire facilities to ensure that we stopped the spread of that deadly virus. Lessons were learned, lives were saved. Imagine if we applied the same commitment, the same urgency, the same resources to the prescription drug and heroin epidemic. The crisis is wearing families down. We need to give them hope. And that's what a comprehensive strategy to address this crisis is all about. And that's what I've been trying to do on the national level in the same way that Governor Hassan and Governor Baker are trying to do on the statewide level. It needs to be comprehensive. We have to look at it from all angles simultaneously. So I went to Mitch McConnell back 6 months ago, and I said to Mitch McConnell, Lexington, Massachusetts, Lexington, Kentucky, we are two of the most hard-hit states. Why don't you and I, Mitch, call for a Surgeon General's report on the opioid, heroin, and alcohol epidemic in the United States of America? 3 weeks ago, Surgeon General Vivek Murthy announced that he will now issue a new report next year, pursuant to the request which Mitch McConnell and I made. A bipartisan request to a bipartisan problem. No Democrat, no Republican. Now, the reason this report is going to be so important is that it will match what happened 50 years ago with the Surgeon General's report on smoking. At that point, 50% of all adults in the United States smoked. It is now down to 18%. There was still this sense that if you smoked, it was your choice. If you smoked, it showed something about yourself, but it didn't affect other people. We've now reduced the number of adults who smoke from 50% down to 18%. How many millions of people's lives are now changed? How many millions of families are now changed permanently because their family member does not smoke? My father said to me when I was 12, as the oldest, that he knew when I was 12 that I would start smoking within the next year. He knew that as someone who had grown up in Lawrence and gone to Lawrence Vocational High School, and he said to me when I was 12 that he started smoking at age 12, and he knew I would too. Just make sure, Eddie, you don't take the quarter out of my pocket. Earn the 25 cents. That's what I did. That was the culture when I was 12 years old. My father died from lung cancer. He died from lung cancer. That was the culture. The ads on TV used to say, 7 out of 10 doctors recommend Chesterfield cigarettes for dealing with your tension. How did they get away with that? How did the medical profession become a part of the problem? How did they allow themselves to have their names associated with something which was obviously a healthcare epidemic? And for my father, no one ever questioned whether or not he was in control of his senses. No one ever said when he was in need of medical help that he would get the medical help. It was smoking. That was acceptable. But that's not true for opioids. That's not true for this problem. It's stigmatized. It's stigmatized in the same way that mental health problems are stigmatized. It's stigmatized in a way that makes it look like it's someone else's problem, that it's not our problem. Well, that's changing. And it's changing rapidly because everyone now knows someone. And everyone knows how profoundly those families are being changed by this problem. And so that's why Mitch McConnell and I are asking for and will be getting a Surgeon General's report on this issue by the end of the next year. And I think that's going to help to create this larger national strategy that we need to implement in order to address this crisis. First, we need to stop the overprescription of pain medication that is leading to heroin addiction and fueling this crisis. Sadly, we have become the United States of Oxy. That's just the reality of it. We are less than 5% of the world's population, and we consume 80% of the global opioid painkillers and 99% of the global supply of hydrocodone and the active ingredient in Vicodin. 99% of all of it is consumed by us. We have the problem. We are the ones who are addicted. We are the ones who have to end this problem. We also need to ensure that prescribers are educated in responsible prescribing practices. The medical community is on the front lines of this problem, and they need to be trained to identify possible substance use of disorders in patients. And that's why I've introduced legislation called the Safe Prescribing of Controlled Substances Act. This bill would require anyone who prescribes opioid pain medication and other controlled substances to undergo mandatory training on safe prescribing practices and identification of possible substance use disorders. It can't just be Massachusetts. It just can't be New Hampshire. It's going to have to be every state, and we're going to need a national law to say that all of these medical professionals who can prescribe have to get ongoing medical education on this issue. It should start here, but there has to be a law, and there can be no